Hello everyone, my name is Bernhard Föllmer and today I present our work on guided active learning for medical image segmentation. But first, let's briefly recap the concept of active learning. Medical image segmentation requires expansive voxel-wise annotation by domain experts. Active learning can reduce this annotation burden by querying only the most informative samples. However, once the sampling strategy is fixed, experts cannot steer the process towards clinical meaningful targets. Standard active learning may also fail under strong class imbalance, unequal uncertainty across classes, or when expert-driven prioritization is required. Targeted active learning selects samples according to predefined task-specific objective. It focuses annotation efforts on underrepresented or clinically available regions. This helps to tackle challenges such as rare class representation, redundancy, or out-of-distribution data. In this paper, we propose guided active learning for medical image segmentation. In the first phase, informative samples are proposed using uncertainty-based criteria such as Monte Carlo dropout. In the second phase, the expert is presented with previously selected candidate samples and selects a subset of relevant samples with respect to the segmentation target by clicking on informative image patches. In the third phase, submodular subset selection is applied to identify samples that are relevant to the expert-defined query set and diverse among themselves, using mutual information measure. In the fourth phase, the selected batch of samples is annotated by refining the pseudo-labels. In our experiments, we use the abdomen segmentation challenge to create a toy dataset simulating foreground-foreground class imbalance by merging the liver and left adrenal gland into a single foreground class. Two targets were defined, maximizing the dice score of the left adrenal gland and the macro dice for both organs. We observed that the performance of predefined targets improves more quickly than with other methods such as random sampling or uncertainty-based methods. When examining the proportion of annotated voxels, we find that conventional approaches tend to oversample large liver regions while neglecting the small left adrenal glands, resulting in suboptimal performance on the target task. In an additional dataset, we perform coronary artery segmentation at the segment level. We defined 4 different targets, including overall segmentation performance of distal right coronary artery, distal left anterior descending artery, and falsely segmented proximal RCA side branches. One challenge of the dataset is the inclusion of non-diagnostic images affected by noise and severe motion artifacts. For coronary artery segmentation, we observe similar behavior across all 4 targets. A qualitative and quantitative evaluation shows that samples selected by random sampling often fail to capture foreground classes. Uncertainty-based methods, on the other hand, tend to select noisy images or images with rare artifacts, as these yield higher uncertainty. Guided active learning is able to steer the selection process towards more informative samples. To conclude, guided active learning can improve both targeted specific and overall segmentation performance. It enhances label efficiency in complex annotation scenarios, such as those with severe noise or motion artifacts. However, its benefit may be limited when no specific target is defined or when conventional methods already capture the relevant regions. Thank you very much for your attention.